As summer approaches, we are in for longer days with lots of sunshine, and that means more people outdoors, of course. Even if you don't spend a lot of time outside, you are still at risk for skin cancer. Statistics show that about 20% of all Americans will develop skin cancer in their lifetime, or about 1 in 5 by the age of 70. Dr. Catherine A. Degasis, a Mayo Clinic dermatologist, is joining us now to talk about skin cancer and how to stay safe. Good morning to you. I have to say, you have absolutely beautiful skin yourself, so I'll believe anything you say. Who is most at risk for skin cancer?
Well, the reality is anyone who has skin is at risk for developing skin cancer, but there are certain risk factors we know can predispose people to be more likely to develop skin cancer. That includes people with light skin and light eyes, or a history of cumulative sun exposure and tanning bed use.
And a lot of older people especially have a history of tanning bed use. That used to be so popular in the 80s and 90s. How common is melanoma?
It's estimated that there will be about 100,000 new cases of melanoma diagnosed in the United States this year alone. But that's not the only type of skin cancer. In fact, non-melanoma skin cancers like basal cell carcinoma and squamous cell carcinoma are actually even more common and can affect up to 5 million people per year.
Yes, I just had a basal cell removed from under my chin, and basal cell is not as serious as melanoma, as you said, but it can disfigure you if you don't catch it early.
That's true. Non-melanoma skin cancers can still contribute to morbidity and mortality. Basal cell carcinomas, as you mentioned, have an exceedingly low risk for spread in the body, but they can be locally disfiguring and locally destructive to underlying structures.
I want to go back to melanoma because you talked about risk factors and having fair skin, et cetera. But African American people can get melanoma as well.
Sure, yeah. Again, anyone with skin can develop any type of skin cancer, and it can affect people regardless of race or ethnicity, age, or gender.
And what are the types of treatment that are available for skin cancer?
Well, it depends on the type of skin cancer and then the histologic subtype. But for non-melanoma skin cancers, treatments can be as simple as a topical cream or local destruction. In many cases, we treat these surgically as well. And in advanced cases of these non-melanoma skin cancers, we can treat with radiation, and sometimes they require chemotherapy or immunotherapy. For melanomas, it always entails treatment with a local surgery. For very early cases of melanoma, local surgery of the lesion alone is all that's required. In later stages or deeper invasive melanomas, then a wide excision of the primary lesion is required, as well as a lymph node surgery, and then in some cases, systemic treatments like immunotherapy or chemo.
Okay, what are the warning signs?
For melanomas, I oftentimes tell patients to think about the A, B, C, D, E. So A is for asymmetry. Any pigmented lesion that's asymmetric is something that we should be aware of or concerned about. B is for border. You want your pigmented lesions to have a nice crisp edge, not a scalloped edge or an undefined edge. C is for color, so that's to recognize pigmented lesions that have multiple colors can be atypical, or a pigmented lesion that's different in color from the rest of your moles. D is for diameter. Oftentimes we tell patients anything greater than 6 millimeters or a pencil eraser. And then really the most important for melanoma is the E of the ABCDEs, which is evolution. Any pigmented lesion that is changing, growing in size, becoming symptomatic like bleeding or itching, likely needs to be evaluated by a dermatologist.
All righty, and we'll remember sunscreen, sunscreen, sunscreen.
Absolutely.
Dr. Catherine Degasis from Mayo Clinic, thank you so much for joining us this morning.
Thank you.